HH is an 8-week-old male presenting for evaluation of PVCs. He was born full term on March 20th via elective C-section. At birth, he was noted to have an irregular rhythm, and mother reports that an echo and EKG were performed in the newborn nursery, and she was instructed to follow up with a cardiologist in a couple weeks. At the cardiologist on May 9th, the Holter was placed, and then a few days later, on Friday, May 12th, mother was contacted to bring the patient into the hospital because he was having frequent PVCs. Aside from his irregular rhythm, mother states the patient is doing well at home, he's been eating well, urinating and stooling as expected, gaining weight, and there have been no unresponsive episodes or color change that she has been aware of. His review of systems was negative. His past medical history: he was born at 39 weeks, full term, weighing 8 pounds, via repeat C-section, and he has no past surgical history. He's on no medications. He has no known diagnosed allergies, and his immunizations are up to date. Family history is negative for congenital heart disease or other cardiac problems. There's no history of arrhythmias or sudden cardiac death, no drownings, or no car accidents. He lives at home with his mother and father and 1 3-year-old brother, and he's been growing well on Enfamil Gentlease. There's no developmental delays or developmental concerns currently. Vital signs this morning were a blood pressure of 85/43, heart rate of 134, and regular rhythm with no PVCs. Temperature was 36.4. SpO2 was 100% on room air. Respirations were 28 breaths per minute. He weighed 5.23 kilos, a length of 60 centimeters, and a head circumference of 41 centimeters. Upon exam, he was smiling, interactive, well-appearing, and in no acute distress. His eyes were clear, normal external ears, nose clear without rhinorrhea, and throat was without erythema or exudate. His neck was supple without lymphadenopathy. Lungs were clear to auscultation bilaterally. He had a regular rate and rhythm with no murmur, and his cap refill was less than 2 seconds, with 2+ pulses throughout. His abdomen was soft and non-tender without distension. He had normal external male genitalia, is uncircumcised, and testes are descended bilaterally. His skin was without rash, and he was moving his extremities equally and with good strength. Neurologically, he's grossly normal, tracks to midline, responds to sound, interacts with caregivers, has an intact suck and Moro reflex. We don't have any labs currently, but an electrolyte panel was sent this morning, which we are awaiting results of. His problem list includes health maintenance, irregular heart rhythm, and premature ventricular contractions. My impression is that HH is a previously healthy 8-week-old male presenting for evaluation of PVCs. He is at risk for life-threatening arrhythmias given history of PVCs and requires hospitalization for monitoring. Our differential includes benign PVCs in the newborn, congenital heart defect, arrhythmogenic right ventricular cardiomyopathy, and long QT syndrome. Plan for him: from a neurological perspective, we'll provide comfort as necessary. From a cardiovascular perspective, we will consult electrophysiology and appreciate their recommendations. We'll await results of his electrolyte panel and correct any electrolyte abnormalities if they present. Continue to observe him on full telemetry monitors and upload his Holter for full evaluation. We will obtain an EKG and echo and continue to monitor. From a respiratory perspective, monitor him on room air and maintain saturations greater than 92%. FENGI will continue on his home Enfamil Feeds PO ad lib, and we will obtain a peripheral IV for access.